I'm Jennifer Cohen. I'm the director of congenital cardiac CT here at Mount Sinai, and I also perform cardiac MRIs. So the main difference between cardiac CT and MRI is the way the pictures are generated. So both are what we call advanced imaging, meaning that they give more detailed cardiac anatomy than, let's say, an echocardiogram. But cardiac CT uses X-rays to create that detailed picture of the heart and blood vessels and gives us very good resolution with that. And it's a quick test that can be done in just a few minutes. On the other hand, cardiac MRI uses a powerful magnetic field, radio waves in a computer to produce those detailed images. And often this test is a lot longer, usually taking between 60 to 90 minutes, depending on the indication. So a cardiac CT has really great spatial resolution. So it's really great at seeing those really small structures in the heart, like coronary arteries. So sometimes we'll get a cardiac CT to see the coronary arteries better, like if there's an abnormal origin of the coronary arteries or following patients with Kawasaki disease. Also to see things like pulmonary veins, pulmonary arteries, aortic arches, really any extravascular structure, cardiac CT is really great for. And as I mentioned, cardiac CT is a lot faster than cardiac MRI. So if you have a child who can't sit still for 60 to 90 minutes, as a lot of children, let's say less than 8, can't do, and you want to see the anatomy well, then those patients would probably be better off getting a cardiac CT because they likely wouldn't need anesthesia for that. There's also some contraindications to cardiac MRI. Like if a patient has a pacemaker and ICD, then they can't get a cardiac MRI, then often they'll get a cardiac CT. So I think the main difference is that we take a lot of time reviewing the patient's history for the patients that are referred to us, both internally and externally, and we protocol and scan these patients ourselves. So we really sit at the scanner, taking the pictures ourselves. And for CT, I really take pride in making sure that we use the least radiation possible. And me being there myself, doing the scan myself really helps that happen. We often use the pictures we get to make 3D reconstructions to help our surgeons and help our cardiac cath doctors perform the most successful procedure possible. So we work really closely with our referring doctors to understand the clinical question well that the MRI or CT is asking. And then with cardiac CTs and pediatrics, we work really closely with our pediatric radiology colleagues to ensure we fully assess all the extra cardiac structures as well. We also perform a lot of cardiac CTs in adult congenital patients, and these are co-read with adult cardiologists and adult radiologists. And this really ensures the most accurate interpretation possible because we all really have our specific areas of expertise that are complementary to each other. I think a physician should refer a patient to us because we really have a sense of perfectionism here when it comes to imaging at Mount Sinai, and that's no exception with our cardiac MRIs or CTs. We really take great pride in obtaining the best images possible, both with CT and MRI. And I think the fact that we protocol and perform these exams ourselves really sets us apart and gives us really great image quality. We always send the reports very quickly to our referring physicians and always highlight the results that we think are most important to them.